Welcome to CBH PAVI. Today, we're exploring a revolutionary approach to treating spinal cord injuries, stem cell therapy. We'll look at what spinal cord injury is, its causes, traditional and emerging treatments, and how stem cell therapy can impact patients' recovery. Stick around for a deeper look at the potential side effects and the future of this promising field. A spinal cord injury, or SCI, is a life-altering event where damage to the spinal cord interferes with communication between the brain and the body. This can cause partial or complete loss of movement, strength, sensation, and even the ability to control bodily functions below the injury level. Injuries to the cervical region, for example, may lead to quadriplegia, affecting all four limbs, while injuries in the thoracic or lumbar spine can lead to paraplegia, impacting only the lower body. The severity of a spinal cord injury depends on whether it's complete or incomplete. In a complete injury, there's no sensation or voluntary movement below the injury site. In an incomplete injury, some nerve signals still pass through, meaning patients may retain some degree of movement and sensation. Understanding this difference is crucial, as it influences treatment approaches and recovery expectations. Spinal cord injuries happen in different ways, usually categorized into traumatic and non-traumatic causes. Let's look at some common causes. Traumatic injuries. These include events like car accidents, falls, sports injuries, and violence, particularly gunshot or stab wounds. Trauma is the leading cause of SCI in young adults and middle-aged individuals. Non-traumatic causes. Certain diseases and medical conditions can damage the spinal cord, such as tumors, infections like meningitis or tuberculosis, multiple sclerosis, and spinal cord degeneration due to arthritis or other age-related conditions. Understanding the cause of a spinal cord injury helps medical professionals determine the best course of action and set realistic recovery goals with patients and their families. After an SCI, the initial focus is on stabilizing the patient and preventing further damage to the spinal cord. Treatment often includes a mix of surgery, medication, and intensive physical therapy. Here's a closer look. Surgery is essential in many cases to stabilize the spine, relieve pressure on the spinal cord, or repair fractures. Surgeons may use rods, plates, or bone grafts to realign and secure the spine. Medications play a key role in managing inflammation, pain, and preventing infections. Steroids like methylprednisolone may be administered immediately after injury to reduce swelling, though their use is debated. Medications are also given to manage symptoms like muscle spasms, bladder control, and pain, which can vary in intensity based on the injury. Physical therapy and rehabilitation help patients retain as much mobility as possible, strengthen the muscles, and improve flexibility. Rehabilitation therapists work closely with SCI patients on exercises to rebuild muscle memory and encourage neural pathways to adapt. Stem cell therapy is a novel and experimental treatment that has generated excitement in the medical community. Stem cells have unique regenerative properties, meaning they can develop into various types of cells, including nerve cells. This potential allows them to replace damaged cells in the spinal cord, restoring some lost functions. In SCI patients, stem cell injections aim to rebuild damaged neural networks, reconnect severed pathways, and stimulate growth in damaged areas. This process could restore movement and sensation, especially in patients with incomplete injuries. While still in its experimental stage, stem cell therapy has shown some patients experiencing increased leg strength, better motor control, and even the ability to stand or walk with support. Reports from some clinical trials and case studies show promising outcomes in spinal cord injury patients who've undergone stem cell therapy. For instance, some patients who initially had limited leg strength reported significant improvements in muscle strength and control post-treatment. These results suggest that stem cells may encourage the growth of new nerve connections in the spinal cord, helping patients to regain voluntary control over certain muscles, particularly in the legs. Though outcomes vary based on the severity and location of the injury, this progress has brought renewed hope to patients and families. Stem cell therapy doesn't usually work alone. It's complemented by medications that support the healing process and manage symptoms. Let's discuss a few key elements of post-therapy care. Patients may need immunosuppressants to reduce the chance of cell rejection. Other medications are used to manage pain, control infections, and maintain bodily functions. Each patient's medication plan is customized based on their needs. After stem cell treatment, continued physical therapy is vital to make the most of any regained function. Therapists focus on strengthening muscles, retraining balance, and maximizing functional independence. Supportive care like this enhances the potential of stem cell treatment, allowing patients to build on any improvements from therapy. Like all medical treatments, stem cell therapy comes with potential risks and side effects. Here's what SCI patients and their families need to know. Since stem cell therapy is typically invasive, there's a risk of infection, especially if immune systems are suppressed. In some cases, the body may reject the introduced cells, leading to an inflammatory response. This can sometimes interfere with recovery. Stem cell therapy is still relatively new, so long-term outcomes and risks are still being studied. Researchers are working to understand how these cells behave over time and to minimize adverse effects. While the risks are present, close monitoring by medical professionals and a personalized approach to each patient can help manage and mitigate these side effects. Stem cell research is rapidly evolving, and the potential for even more effective treatments is on the horizon. Clinical trials are underway worldwide, aiming to refine stem cell techniques, improve patient outcomes, and reduce risks. In the future, we may see stem cell therapy become a standard treatment for SCI, offering improved recovery options for millions affected by spinal cord injuries. Stem cell therapy is offering hope and new possibilities to those living with spinal cord injuries. While the treatment is still in development, its potential to restore strength, sensation, and function is inspiring. If you found this video informative, don't forget to like, share, and subscribe to CBH PAVI for more insights on medical advancements and treatments.